Picture yourself driving down the street when suddenly you meet a state patrol car with a front seat passenger. You can't believe your eyes because the passenger is a big, fuzzy, brown bear called Buckle Bear. Now you ask yourself, what idiot would get inside a Buckle Bear costume? Well, I can tell you that that idiot is me. I'm Susan Bochart. I'm Health Promotion Coordinator for Central Nebraska Community Services, a private nonprofit organization. Using Buckle Bear to enhance safety seatbelt education is just one of the many varied duties I perform to complete health prevention strategies. Today I'm going to tell you about my various job duties. Those include project outreach, education, and program administration. All of these duties have one common goal, and that is to save the lives of Central Nebraskans. So let's first talk about outreach. Advertising in a nonprofit corporation is called outreach, and it's obvious that people need to be aware of programs before they can be helped. So, mixed media is used to reach those who can benefit from programs including radio, newspaper, and billboard advertising. In addition to using media, outreach materials such as letters for bulk mailing, brochures, newsletters, and flyers are written and distributed. The second set of duties I perform is education. Education with the public, clients, community partners, and state legislators. That education includes health and safety program awareness, and it's most effective when it's accompanied with genuine caring. Examples of some of the education I do is I get inside of child safety seats with parents to help them install them correctly at inspection stations. I remind kindergartners to listen for the click when presenting on the importance of wearing a seatbelt through the Hall County STARS project. I take breast models with me to health fairs to educate women on how to do a self-exam for their breast for prevention of breast cancer. And I can tell you that's through the Every Woman Matters program. Now I can tell you too that sometimes when I've left my table unattended for a few minutes and 10-year-olds are around, they can be murder on my boobs. Talking to family members over the telephone about finding a respite provider so they can take time away from caregiving to relax, renew themselves through the Nebraska Respite Program is also education that's completed. Another example is attending meetings with community partners to inform them of our programs and to ask them to refer to their clients, those that can be helped through our programs. And last, reaching state legislators through events like Cookie Day and luncheons, provide them with education on how much money is being saved through these prevention programs. Now, although the health promotion and education parts of my job are fun, completing administrative duties are required to support and sustain those other facets of my job. So, some of the duties I do under administration are writing grants for funding, reporting to funding sources, our accomplishments and evaluation results, ensuring policies and procedures are in place and followed, completing budget oversight, that includes making decisions about how budgets should be spent, and supervising and training staff. So now you know that my job duties, program outreach, education, and administration are helping to complete the strategies of health prevention. But I wonder, are you still wondering how Buckle Bear and boobs help to save lives? Think of these individuals that I encounter. First, a fourth grader buckles his seatbelt after seeing an unsecured egg crash and break in a toy car. A woman goes in for her annual exam after hearing that 90% of breast cancers are curable if there's early detection. A son caring for his father who has Alzheimer's disease finally got a full night's sleep when the respite provider came and took care of his dad. Caring for people by providing answers, breaking down barriers, and seeing behavior change for a healthier lifestyle is an invaluable reward that I have been blessed with through my job for these past 20 years.